Good day, everyone. Today we're going to talk about schizophrenia. Schizophrenia, previously known as dementia precox, a Latin-based word which means out of one's mind before one's time. It is a long-lasting psychotic disorder in which those who are affected by it will be unable to distinguish which is real and which is fantasy. They also have disturbances in their thinking, emotion, behavior, and perception. Schizophrenia usually happens in late teens or in the early 20s. There are several symptoms that can be seen in schizophrenic persons, in which it is further divided into two categories, which are the positive symptoms and negative symptoms. For positive symptoms, there will be an excessive or distortion of normal function. This will include hallucinations, emotional disturbances, disorganized and extremely odd behavior, and most importantly, delusions. In contrast, negative symptoms might be having a decrease in normal function. These can be seen through speech disturbances, poor attention, and lack of effect. For a person to be diagnosed as schizophrenic, according to American Psychology Association 2013, two or more symptoms must be frequently present for at least a month to be concluded as schizophrenic.
Hi, my name is Amanda, and I will present about our group's significant findings. So, what we have found through this our study is that schizophrenia, in short, is schizo. We have found that this illness is very rare and only a few people know about it, even though it has been around for centuries. And the benefits of knowing the benefits of learning about schizophrenia is that number one is that we know what are the triggering factors of this illness, and which that brings to the second point is that we are able to assist the sufferers to undergo treatment, and what are some of the effects that we have found. Some of the effects of schizo to the sufferer that we have found is hallucination. They could experience delusional and could potentially experience some extreme behavior. So through our studies, through reading, we have found that there is no specific treatment for schizophrenia, but it can be treated and managed, and to help the sufferer do their daily tasks, to ease in their daily tasks. So that is all from me. Thank you.
So hello and hi everyone, I'm Amirah. The cause of schizophrenia is number 1, having a family history. That means some of the member has a symptom of schizophrenia. Number 2 is some pregnancy and birth complications such as malnutrition, exposure to toxin or virus that may impact the brain development. The last cause is taking drugs during teenagers and young adulthood. The effect of schizophrenia can result several problems that affect every area of life. Number 1, suicide attempts and thought of suicide. Number 2 is health and medical problems, and the last one is aggressive behavior.
My name is Erlinnia Binti Yusop, and I'm gonna talk about the challenges of taking care of schizophrenia patients. The first challenges is the stigma of society towards the mentally ill, which is not good, like insulting the patient to the point of associating the patient's family members, causing the guardians to suffer from depression and unable to accept the fact that their family member have schizophrenia. This causes the guardian to confine the patient to the public, and this will give a negative impact to the patient. The second challenges is the patient condition. Patients often experience emotional changes that will occur suddenly from calm to aggressive. Guardians should be careful with the patient's condition like this. The third challenges is the guardian's ability, which encompasses mental, physical, and social factors, in which they have the willingness and patience to deal with and interact with these patients. The other challenges is knowledge of schizophrenia patients. Of knowledge about these patients causes guardians to be at risk of dealing with the patients. For example, is lack of knowledge in terms of patient emotional changes, medication intake, and the dosage as well. Knowledge related to mental illness is important in overcoming the challenges of guardians.
Moving on to the treatments of schizophrenia. Basically, there are a few treatments that could be carried out to treat schizophrenia, and in some cases, it will require hospitalization. The first treatment would be medication, in which the patient with schizophrenia are given antipsychotic medication to treat their symptoms. Besides that, psychosocial intervention such as individual therapy, social skills training, family therapy, vocational rehabilitation, and supported employment can be conducted to manage their illness. Last but not least, for adults with schizophrenia who do not respond to drug therapy, electroconvulsive therapy (ECT) may be considered.
In conclusion, we can say that care, moral support, and love of those people around can encourage schizophrenia patients become members of the normal community but in a sheltered environment. We should always listen and have empathy for schizophrenia patients so they know that their lives are still worth it.